The protest involved the 2020, 2021 and 2022 batches of the unemployed graduate nurses and midwives. The low turnout of members would not deter the few from marching from the Kumasi Cultural Center through some principal streets of the city to register their discontent. Haruna Ibrahim is the president of the Graduate Unemployed Nurses and Midwives Association.
When we had the first demonstration in Tamale, we were told that the Ministry of Health and then the Ministry of Finance are meeting to discuss I don't know who instructed that, but then that was the message we got, that they have been assigned to instructed to meet to discuss our clearance. The next day, we saw a release from the Ministry of Health addressing what we described as ghost officials at the Ministry of Health. At the Ministry of Health and Ministry of Finance, we think there are people there who are giving financial clearance and postings to some of our colleagues who can afford between 5,000 to 10,000. And when that money they pay to them, and immediately they get posted.
We have evidence to this allegation.
We know if there is no evidence, we have colleagues who are working on the field. When you ask them, they say we did special posting.
4 years after graduating from nursing and midwifery training colleges across the country, the health professionals are yet to be posted to translate their theoretical knowledge into practice. With many health workers exiting the shores of the country to seek greener pastures, there is an obvious gap and shortage of human resource in the health sector. Records from the Ghana Registered Nurses and Midwives Association indicates that over 6,000 of their members have left between August 2023 and March 2024. The unemployed nurses and midwives, some of whom have had to take alternative job opportunities, share their frustrations.
I used to work with a private hospital, and then with the pay and the expenses at the end of the month, it wasn't enough. It isn't enough for us. So we are really frustrated in the house. Mentally, we are not mentally sound because it's not easy to complete school for 4 years and being in the house. Our parents are looking forward to us to take care of our young siblings. Now that we are in the house, how are you going to care for them?
Some died as a result of these driving, and some people also buy sell onion and other things. So it has been a whole lot of frustration.
The aggrieved health graduates presented a petition to the Ashanti Regional Coordinating Council for onward submission to relevant state institutions. The group plans to picket the finance and health ministries if their demands are not met.
After today, we hope and pray that after this our clearance is issued. Other than that, our next thing is we are going to sleep at the Ministry of Health and Ministry of Finance. So when we are going with our mats and our clothes. We are going to sleep there until our postings is given to us.
For Joy News, my name is Emmanuel Bright Kweku.